For the assessment of blood pressure with the SECA mVSA, the following preconditions should be given. Make sure the patient did not smoke, eat, drink caffeinated beverages and alcohol, or exercise within 30 minutes before measuring blood pressure. Ensure at least 5 minutes of quiet rest before conducting the measurement. During the measurement, ask the patient to relax and not talk. Ideally, the patient should be sitting on a chair with his or her back straight and supported. In clinical settings in which patients are unable to sit, bring the backrest of the bed into an upright position. When sitting, assure that the feet of the patient are flat on the floor and that the legs are not crossed. It is of importance to choose the right cuff size. The SECA mVSA offers 4 different sizes: small, medium, large, and extra large. All SECA cuffs are clearly marked with the individual size and also indicate the arm circumference ranges. For evaluating the correct cuff size, make use of its hatched area. When applying the cuff to the patient's arm, the white line next to the rough Velcro side should be within the indicated boundaries. If this is not the case, choose an alternative size. When positioning the cuff, ensure that the artery labeling is positioned according to the brachial artery of the patient's upper arm. The cuff is then applied firmly, ideally on the left arm of the patient. The correct position of the cuff is 2 fingers above the crook of the arm. The tightness can be verified by checking if 1 finger breadth just about fits between cuff and arm. A too loose cuff would result in too high blood pressure values. Ideally, no thick layers of clothing should be worn underneath the cuff, as this may provoke incorrect blood pressure readings. The factory setting of the SECA mVSA is set to the so-called inflation mode. This mode will try to detect pulsations up to a maximum of 210 millimeters of mercury during the early inflation of the cuff. Inflation mode is more comfortable for the patient, as not so much pressure has to be applied to the cuff. If no pulsation could be detected, the device will automatically change to deflation mode. In deflation mode, comparable to the auscultatory method, the cuff will be inflated up to a defined start pressure first. From there, the pressure is released by the device automatically in increments until a pulsation is detected and the reading is successful. To change from inflation to deflation, simply click on the blood pressure tab, choose deflation, and set the start pressure. The next measurement will then be conducted in deflation mode. To change the default inflation mode setting, simply change the predefined settings within the administration settings of the device. All measurements will then be carried out in deflation mode unless changed before each measurement. Do not leave the patient unattended during a measurement. Should the pressure be too uncomfortable for the patient, press the stop button and repeat the measurement a different time or manually.